Comparison of classic and contemporary nursing theory. This PowerPoint presentation compares Dorothea Elizabeth Orem's theory with Neuman's system model. It provides a brief background and philosophy about the theory and model alongside the core concepts, assumptions, differences, similarities, and limitations. For the background, Orem's self-care theory was developed, like I said, by Dorothea Elizabeth Orem. The theory focuses on patients' ability, individuality, and self-care abilities. The theory describes nursing as the act of helping others within the management of self-care. For Neuman's systems model, it was created by Betty Neuman. This model is based on the person's relationship to stress, response, and reconstitution factors that are progressive in nature. The Neuman systems model presents a broad, holistic, and systems-based method to nursing. Dorothea Elizabeth Orem was grounded in the philosophy that patients can recover if they care for themselves. Neuman's central principle of the model is associated with energy resources such as organ strength and response patterns. These lines represent internal factors that help patients cope with stress. The core concepts for Orem's self-care theory, nursing, so it's a trained person providing self-care assistance, and the humans are the care recipients. The self-care agency, the power to act deliberately in meeting one's own needs. For Neuman's system model, human beings interact with internal and external environmental stressors or forces. Health is the condition or degree of system stability viewed as a continuum from wellness to illness. The applicability of the theory for Orem's theory it is the role of the nurse is to meet self-care deficits. The goal is to encourage the patient to participate in meeting self-care requirements. An example, Orem self-care theory can be used to assess patient condition, identify their needs, ensure effective communication, solve the identified problems, and evaluate the extent to which the process was effective. Applicability of the system model. Neuman's system model is, in practice, implies that the discovery of stressors can influence the poor well-being of patients. A nurse is responsible for considering patient psychosocial, physical, developmental, spiritual, and interpersonal factors when eliminating the adverse impact of stress factors on patients. The assumption for Orem self-care theory: to stay healthy and remain useful must engage in constant communication to connect among themselves and with the environment. Adults experience hardships taking care of self and others when making life-sustaining and activity-regulating actions. Furthermore, Neuman's model says each patient is unique in his or her characteristics and factors within a basic structure of responses. Each stressor influenced how much a person is protected by the line of defense. The differences and similarities. While Orem's theory encourages a patient to be independent in addressing their healthcare needs, Neuman's model underlines the role of several factors in shaping the approach to care. Similarities in both theories. Both theories acknowledge the importance of nurses as integral parts of the care process, which means that the two can be used in conjunction to achieve optimal care quality. Limitations. Orem's self-care theory says health is usually considered dynamic and ever-changing. The theory is complex. Words like self-care deficit, self-care requisite, self-care agency, universal self-care, and self-care demand could be confusing to the reader. The theory does not acknowledge individuals' emotional needs and neglects the humanistic perspective, while Neuman's model uses words like interpersonal and extrapersonal stressors needs to be clarified.